Mike, thanks so much for being with me today. You and I met many years ago in New York City when you were hosting an evening fundraiser about prostate cancer. Was that the start of your focus on philanthropy, or did it occur before then?
No, my first focus on philanthropy is I rode my bike and collected money for what was called the March of Dimes.
Sure.
And so I got to be the block captain at 10 or 11 years old. And in our little community, I went around door to door and raised money for the March of Dimes and later the American Cancer Society. And like anyone in America, you have 1 in 2 men will get cancer in their lifetime, 1 in 3 women. And so I was thrust at a very young age into relatives, aunts, uncles, mother-in-laws, fathers, etc., who had life-threatening diseases and unfortunately passed away. And I have such an appreciation for how you treat a patient at the end of their life with dignity. And so many patients, as they get life-threatening diseases, lose all dignity.
We are so very pleased to honor you this year with our Champion of Care Award for your many years of philanthropy support for cancer and other serious disease. Can you talk a little bit about the progress you've seen on outcomes over the years and what you see ahead, perhaps, in terms of progress with cancer and other serious illness?
Well, I'm very optimistic of what's going on in medical research today. I've been working in the field of cancer for now more than 50 years. So when my father was diagnosed with melanoma in the early 70s and my mother-in-law with breast cancer, there wasn't many alternatives.
Back then there wasn't much that you could, rely on, right?
Well, I visited with almost every major cancer center. And when my father had a reoccurrence in the mid-70s, I basically concluded that science could not move fast enough to save my father's life. And I was working on Wall Street and eventually moved my entire group to Los Angeles so that our 2 children who were born at the time, our 2 sons, Lori's and mine, would meet and knew my father before he died. And he died about 10 months after we returned to Los Angeles. Mm-hmm. And so it's one of these things that life gets in the way. We had many family health challenges of many sorts, and so definitely thrust in first as a philanthropist, and then about 30 years ago as a patient myself. And I would say there's enormous hope today for patients. And so when you think about cancer, and as you know better than I, maybe 1/3 of people in hospice care today are related to cancer.
That's correct.
And so as we focused on cancer, we discovered there were 3 reasons generally why a person got cancer. 1, your immune system was weakened, you had sick, etc., and didn't have the strength to fight off carcinogens or mutations. 2, your immune system didn't recognize your cancer, it was disguised. Or 3, your immune system was actually turned off. And so what Jim Allison, who won a Nobel Prize for about 20 years after we began funding him, he found a way to turn off the switch that was turning off your immune system. And the minute you turn your immune system back on, it was most effective in cancer and melanoma being number 1. So we're sitting here today and there are hundreds of thousands of cancer patients living normal lives today. And I'd say there's 15 to 16 million today in remission just in America. Yeah. But we don't have the complete answer for everyone. And you now think at the end of your life, are you going to be treated with respect? Are people going to care for you? Are you going to go into a hospital and they tell you, your mother is dying, but you have to leave by 7 to 8 o'clock because visitors aren't allowed to be with that? You have to check in the morning. And so when my mother passed away last year at 99, and when I think about how your last years are with your loved ones and the experiences, and in our case, did our grandchildren get to spend enough time that they'll remember their great-grandmother or not? A hospice has played a very important role with my family and many other families.
As you know, the vast majority of families that enter a loved one into hospice care have that care provided in their home or wherever the patient resides. And that's where people want to spend their last days with their family, their close friends, familiar surroundings. But 5% of the time, usually in the last several weeks of life, sometimes a patient needs around-the-clock, one-on-one care to make sure they're comfortable and pain-free. And that's why we operate, Capital Caring Health operates in the DC metro area 2 hospice inpatient centers, one on the grounds of Sibley Memorial Hospital in Washington, D.C., and the other out near Dulles Airport in Loudoun County. At our gala, we're focusing specifically on getting folks to support our Washington, D.C. inpatient center, this fabulous Sibley Hospital facility called the Washington Home Foundation and Capital Caring Center for Caring. As you alluded to a few minutes ago, at hospice inpatient centers like the one at Sibley Memorial Hospital that we operate, family members and close friends can come and go anytime, day or night. There are no visiting hours. It's 24/7 visitation. They can even spend the night with the patient. The challenge is that there are very few of these inpatient centers in operation. We operate, as I said, the only one in Washington, the only one in Northern Virginia, because insurance never covers the full cost. This is the type of care that is provided nowhere else. You can't even remotely get it in a hospital. They're not, geared for that sort of thing. We have the Washington Home Foundation, who helped us with a huge grant to build out our care center, our inpatient center at Sibley, several years ago. It's been in operation 2 years this February. And the Washington Home is also offering a challenge grant of $150,000 that they're throwing on the table and hoping other people at our gala will support.
People think that it's the patient themselves, but it's not just the patient.
No.
It's the family, etc. And I know when my father was dying of melanoma, it was wearing down my mother. And to have a place to go where she had a few hours off, and we don't recognize the collateral damage that is done to a family and organization from a patient who has a serious life-threatening disease. And so, whereas you'd like to have them in your home, even if you could afford to have round the clock, in some ways, the person has to have some breathing time. They have to have some time off. And so in many cases, I believe a hospice has not just provided care to the patient, but has provided care to the family, that there's some normalcy in their life.
In fact, the family is often under more stress than the patient.
Right. So that's why I am happy to match the gift, the challenge gift of $150,000 for this event for
Wow.
you.
That's fantastic.
Because I have seen the role that a hospice plays in a community.
Mike, that's very, very generous of you.
And no, I just am so impressed with the work you do, and think about those individuals that you've provided peace for them, but also peace for the other family members, knowing that they're in a place that would be safe for them.
I can tell you on behalf of all of the employees of Capital Caring, our volunteers, our other supporters, thank you so very much for your generous offering. It will go to great use. And our mission is to keep these inpatient hospice centers going. And with people like you supporting us, I know that will happen. You know what, by the way, we should challenge folks at our gala to throw in another 150,000 on top of yours. Thanks for being with me today. Thanks for talking to all the folks that are participating in our gala and elsewhere. It's just wonderful that you can make the time to be with us, Mike.
Well, I think we all should thank you and the organization for what you do and the commitment that you have to give people dignity in their life.